I want to start with a confession and an apology. I did train as an economist, but ever since then I've been trying to become a decent person, so I hope you'll find that communication. And I'm going to do fairly rapidly because of the time here. We picked human resources because it was an issue that had come up in so many of your lists of concerns. I listened to Elizabeth yesterday, so I started with a problem. And I was reminded over lunch that as you look at how you define your problems, here's a list of them, but it's not complete because it's not only in some countries too few workers, the wrong kinds are unskilled, but as I learned over lunch from our colleague from Ghana, they're in the wrong places, distribution. So many different countries, many different issues, not just doctors and nurses, huge differences across countries. There's some that are close and some that are far from solving these problems. And huge commitments to scale this up. You probably know this from within your own country, certainly at the global level. There are grand promises made. Gordon Brown has announced that he would stand by adding 1 million more health workers for Africa. We sort of through the back channel said, have you done the math? Can you afford to do that? How long is it going to take? And the answer was, oops, we didn't do that. What they said proudly is, well, you should be proud of us because Gordon originally was going to say 4 million, and we talked him down from 4 to 1. Now, unfunded liabilities is a concept I borrowed from the investment world, namely when promises are made, commitments are made, programs are rolled out. Has anybody thought about what the implications of that are going to be? So one example is that meeting the Millennium Development Challenge goals, which are terrifically important, everybody signed up. But if we do meet them, will we be able to have the health workers in place to actually carry out on a long-term sustainable basis what that implies? So that's why I've been emphasizing the does it all add up? What's the cost? Can it be met? And what I want to get into a little bit here, this is a big topic. We've only got a little bit of time, so we could spend another week, Elizabeth, on this, is that sometimes simple calculations can lead you far astray if you don't take into account some things. In the case of health workers, you do have to train them from the ground up. And you have more health workers in place, that induces more services, that induces more costs. So more careful analysis is needed in every country for itself. And the countries here have done that, I have learned. But it's an ongoing thing that we always need to go on doing. By the way, I would add, when you come back here for GHLI, did I say that right, 2, you should also advise this country about how to fix its health problems. So a little bit about some efforts to help give you the tools to think about these problems. There are some global task forces. Many people here are familiar with them. I'm not going to dwell on them. Migration is a huge issue, the brain drain. I know from talking to several of you. There are efforts to try and do things that the receiving countries would undertake. Some countries, I think Norway is committing to, for every worker that comes to them, to pay back the equivalent to go to the country that's sending. There's some other efforts, but don't hold your breath. And I know how wise and experienced you are. These efforts are not necessarily going to change the challenges that we all face all the time. Similarly on pre-service training and building up on that. I'm going to focus on the costs and financing. And that's an area where there are a couple of steps forward that might be helpful, really that build on learning from what the countries here and other countries are doing. So once again, as Rob said, what this is really about this week is getting the tremendous experience and thoughts that are in each of your heads to all of your heads, including, I hope, mine. There are a couple of things that will be available to you by email. There's a paper that reviews some of the recent experience of that. I have a paper copy here. It'll be available by email. And there's another paper that's what countries can do now. It brings together some experiences. Actually, the title is 29 Things that Countries Can Do Now. It's been a big seller, and you'll have it. And so I asked somebody, why do you think this is sold so well? Or it's free, but I mean, why has it been so popular? I said, why 29? You know, why not 30 or 24 or 26? So there's a list of issues and ways to tackle them, like the fiscal space issue. You want to have more health workers, got to pay for them. That means that your government budget has to have room. How do you tackle the Minister of Finance to get more fiscal space, more space out of the fiscal pie to make room for that? I'm going to focus mainly on this idea of a simple analytical tool, which is also available for free, open source to everybody, and I'll leave you with how you can get your hands on it and take it home. So there are a couple of things here you can take home and use. And this thing called the Resource Requirement Tool is basically just a set of spreadsheets. So it's not a big black box, it's not a big model, it's not attempting to, it's not pretentious. But it's just saying that if you think about a couple of elements that have to be thought through and then have connections with each other when you're thinking, well, how many health workers of different cadres in different regions do we think we need? How much does that cost? What are the implications of? How does that add up to? And I'm going to talk a little bit about these tools not only as devices to clear one's mind, but also as devices to help with making the case to whoever else, whether it's the ministries of finance or others, need to be convinced. And this little simple device has three main parts to it, one of which estimates resource requirements for public sector human resources, accounting for what's going on in the private sector, then the second part on pre-service, and then the third part, which brings it all together and estimates the gap between the required and the available funds. Anybody use this or familiar with this tool? Because something like 18 countries have already, although it's relatively newly developed, already expressed a lot of interest in, and it's something that is deliberately simple so that anybody can learn it and use it and with their own assumptions, not black box, no mystery to it at all. Now, if you saw the first Star Wars movie, there was the famous moment when Harrison Ford and whatever gaggle of strange creatures he was with in his spaceship with was trying to escape some pursuers, and we all waited on the edge of our seats, and then he pressed a button and went into hyperspace. And that's an old movie, but it's been around for a while. That sort of changed my world. We're about to go into hyperspace because of the time, and I'm not going to present properly the slides that follow. I'm going to go through them as though they were hyperspace, fast. But you will have them. You'll have the whole presentation. And it's just to break down each of these components and say what goes on. One introduces data or assumptions. You have data? Great. On your country? Great. If you don't, what assumptions do you want to start from? Got to make assumptions, so be explicit about them. That's the logic here. Let's bring out all of the stuff that we're making assumptions about. The country, the HRH, cadre, doctors, nurses, and so on, geographic area, the whole bit. Just lay it all out there. Let the machine do the arithmetic. But the thinking has to come from us. And then construct scenarios where we're not sure about the assumptions. Let's vary them. Does it make a difference? If we were wrong in our assumptions and varied them from what we thought it might be to what it might be an extreme, does that make a difference in the outcome or not? That's the whole bit about scenario analysis. Looking at all the usual things, are there bonuses being offered? I know a number of countries wrestle with how do you get healthcare workers to go to remote regions? Do you offer bonuses? Are they location, deployment, or performance related, and so on? Lots more there. You then generate results that enable you to look at what's going to happen to your healthcare costs. This is just a simple application. In this case, during that time period, the costs are going to increase by approximately 50%, looking at those numbers. This is just a hypothetical application. The real application will probably have more variation in it. The second component is the pre-service training component. And that turns out in discussions with people like Gordon Brown to be something that doesn't often adequately get thought about. It takes a long time to train doctors and nurses. It takes a long time to upgrade existing health workers. You all know that. And that is costly, and there's a question of how much budget you've got and where you start from. Lots more to say there, but again, here we are in hyperspace. We're just giving you the overview. You can study it when you take it home. Again, you can do scenarios. You can vary things. You pull together all the people that you have who have the knowledge available, the evidence, and the gaps in the evidence, and you say, well, let's lay it all out. Let's make some assumptions. And then let's try changes and see what difference it makes. Again, you can generate outputs like this, which tells you how your costs are going to increase. This is basically dollars. How your costs are going to increase from expansion of the current level and additional beyond your capacity level. The third component is estimating the gap, the ability to fund based on what you need and what you got. What you need today and tomorrow and future years, and what your budget is likely to do. Again, you can check those assumptions. You can say, what if we're less successful in convincing the Ministry of Finance to give us a bit more, or what if we're more successful? What difference would that make to us? What do we assume about donors? What do we assume about GDP? Actually, the logic here is how much of GDP is being captured in taxes by government, what share of that is going to health, and what share of that is available for spending on health workers. And similarly, in terms of how household spending starts at one level and what it is available for health. Scenarios and results. So here is the result showing a gap, how much is needed, and how much is likely to be available over time. Again, this, the information that you generate from a very simple tool like this is only as good as the effort you put in. It's just doing the math. It's just a little simple calculator. So it's not that it's going to change one's world as one thinks about it, but it can be useful to have information like this. And I remember talking to one Minister of Finance who said he'd be a lot more friendly, a lot more predisposed to give more resources to health if he felt there was solid analysis being presented to them. Maybe that's not true in every country, but it does seem to come up. Now, this whole thing can then be used in feedback. You can say, all right, we got various scenarios, we got various outputs. Now let's take those and go back and ask, well, the plans that we thought we committed ourselves to, the plans that the president announced last year, don't really add up. So let's go back and see how we would have to change those plans to make them. This is what Gordon Brown should have done. We're working on him, but he's only got a short life left before he leaves office. So there's the potential of doing feedback and also monitoring over time. So you do this sort of exercise. Once, you go back to it, and again. And it's not very complicated, just simple spreadsheets, easy to learn, nothing complicated or hidden. It is not a forecasting tool. It's not going to tell you what's going to happen tomorrow. It's not for quote-unquote manpower planning, which is to go in great detail and say, in the Dodoma district over in the Great Eastern Swamp, we're going to need 15 nurses of this kind and 4 nurses of that kind. That kind of detailed planning, very hard. Some would say cannot be done. Certainly no pretensions that this kind of simple analysis can do that. It's also not a replication of other tools, but it certainly draws on them quite explicitly, some of which you may have heard of. It's been used in a number of countries. In Peru, they did a course for 30 leaders in the Ministry of Health, and then prepared as they were preparing their decentralized health insurance system, they used this tool and fit it to their special needs. Mozambique had already done their own cost estimates separately, but they were not so sure how robust those estimates were. So they used this tool. They were very happy to find similar results. Might not have happened that way. But it gave them and their partners, donors, a little bit more confidence. More donor money came in. In Uganda, similar kind of experience. They had worked on various pieces of human resources development separately but had not tackled the cost and financing. So they used this analysis. And it's always country-owned and country-driven. It's not something that's being done by outsiders. So, and it's something that within the health sector, the leaders and the teams can do for themselves. And they had a fairly happy result. I'm not trying to sell you the tool because it's free. But I am now going to finish and with some questions. What are the toughest problems that you're facing in managing your human resources for health? I list a few issues there. What solutions are you considering? Are there lessons from your experience that can help others? And how can Yale and others help? I also want to close by saying that I suggest you reflect on this material at two different levels. One is about human resources for health issues and this tool. Can it be helpful? Can it be adapted to be helpful, et cetera? But secondly, second level, think about whether uses of simple analytical tools, whatever they are, whatever subject they're on, can be useful, and what are their pitfalls? What are their pluses? What are their minuses? Do they help make the case, even if they haven't given you new insights? Do they give you new insights? And can they, if they're not carefully used, can they be misleading or can they be harmful?